Overview. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips and spine. Osteoarthritis symptoms can usually be managed, although the damage to joints can't be reversed. Staying active, maintaining a healthy weight and receiving certain treatments might slow progression of the disease and help improve pain and joint function. Symptoms. Osteoarthritis symptoms often develop slowly and worsen over time. Signs and symptoms of osteoarthritis include pain. Affected joints might hurt during or after movement. Stiffness. Joint stiffness might be most noticeable upon awakening or after being inactive. Tenderness. Your joint might feel tender when you apply light pressure to or near it. Loss of flexibility. You might not be able to move your joint through its full range of motion. Grating sensation. You might feel a grating sensation when you use the joint, and you might hear popping or crackling. Bone spurs. These extra bits of bone, which feel like hard lumps, can form around the affected joint. Swelling. This might be caused by soft tissue inflammation around the joint. Bone spurs on spine. In osteoarthritis of the spine, discs narrow and bone spurs form. Osteoarthritis of the hip. The hip joint shown on the left side of the image is normal, but the hip joint shown on the right side of the image shows deterioration of cartilage and the formation of bone spurs due to osteoarthritis. Causes. Osteoarthritis occurs when the cartilage that cushions the ends of bones in your joints gradually deteriorates. Cartilage is a firm, slippery tissue that enables nearly frictionless joint motion. Eventually, if the cartilage wears down completely, bone will rub on bone. Osteoarthritis has often been referred to as a wear and tear disease. But besides the breakdown of cartilage, osteoarthritis affects the entire joint. It causes changes in the bone and deterioration of the connective tissues that hold the joint together and attach muscle to bone. It also causes inflammation of the joint lining. Risk factors. Factors that can increase your risk of osteoarthritis include older age. The risk of osteoarthritis increases with age. Sex. Women are more likely to develop osteoarthritis, though it isn't clear why. Obesity. Carrying extra body weight contributes to osteoarthritis in several ways, and the more you weigh, the greater your risk. Increased weight adds stress to weight-bearing joints, such as your hips and knees. Also, fat tissue produces proteins that can cause harmful inflammation in and around your joints. Joint injuries. Injuries, such as those that occur when playing sports or from an accident, can increase the risk of osteoarthritis. Even injuries that occurred many years ago and seemingly healed can increase your risk of osteoarthritis. Repeated stress on the joint. If your job or a sport you play places repetitive stress on a joint, that joint might eventually develop osteoarthritis. Genetics. Some people inherit a tendency to develop osteoarthritis. Bone deformities. Some people are born with malformed joints or defective cartilage. Certain metabolic diseases. These include diabetes and a condition in which your body has too much iron, hemochromatosis. Complications. Osteoarthritis is a degenerative disease that worsens over time, often resulting in chronic pain. Joint pain and stiffness can become severe enough to make daily tasks difficult. Depression and sleep disturbances can result from the pain and disability of osteoarthritis. Diagnosis. During the physical exam, your doctor will check your affected joint for tenderness, swelling, redness and flexibility. Imaging tests. To get pictures of the affected joint, your doctor might recommend X-rays. Cartilage doesn't show up on X-ray images, but cartilage loss is revealed by a narrowing of the space between the bones in your joint. An X-ray can also show bone spurs around a joint. Magnetic resonance imaging, MRI. And magnetic resonance imaging, MRI, uses radio waves and a strong magnetic field to produce detailed images of bone and soft tissues, including cartilage. An MRI isn't commonly needed to diagnose osteoarthritis but can help provide more information in complex cases. Lab tests. Analyzing your blood or joint fluid can help confirm the diagnosis. Blood tests. Although there's no blood test for osteoarthritis, certain tests can help rule out other causes of joint pain, such as rheumatoid arthritis. Joint fluid analysis. Your doctor might use a needle to draw fluid from an affected joint. The fluid is then tested for inflammation and to determine whether your pain is caused by gout or an infection rather than osteoarthritis. Treatment. Osteoarthritis can't be reversed, but treatments can reduce pain and help you move better. Medications. Medications that can help relieve osteoarthritis symptoms, primarily pain, include acetaminophen. Acetaminophen, Tylenol, others, has been shown to help some people with osteoarthritis who have mild to moderate pain. Taking more than the recommended dose of acetaminophen can cause liver damage. Nonsteroidal anti-inflammatory drugs, NSAIDs. Over-the-counter nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, Motrin Ib, others, and naproxen sodium, Aleve, taken at the recommended doses, typically relieve osteoarthritis pain. Stronger NSAIDs are available by prescription. NSAIDs can cause stomach upset, cardiovascular problems, bleeding problems, and liver and kidney damage. NSAIDs as gels, applied to the skin over the affected joint, have fewer side effects and may relieve pain just as well. Duloxetine, Cymbalta. Normally used as an antidepressant, this medication is also approved to treat chronic pain, including osteoarthritis pain. Therapy. Physical therapy. A physical therapist can show you exercises to strengthen the muscles around your joint, increase your flexibility and reduce pain. Regular gentle exercise that you do on your own, such as swimming or walking, can be equally effective. Occupational therapy. An occupational therapist can help you discover ways to do everyday tasks without putting extra stress on your already painful joint. For instance, a toothbrush with a large grip could make brushing your teeth easier if you have osteoarthritis in your hands. A bench in your shower could help relieve the pain of standing if you have knee osteoarthritis. Transcutaneous electrical nerve stimulation, TENS. This uses a low-voltage electrical current to relieve pain. It provides short-term relief for some people with knee and hip osteoarthritis. Surgical and other procedures. If conservative treatments don't help, you might want to consider procedures such as cortisone injections. Injections of a corticosteroid into your joint might relieve pain for a few weeks. Your doctor numbs the area around your joint, then places a needle into the space within your joint and injects medication. The number of cortisone injections you can receive each year is generally limited to 3 or 4, because the medication can worsen joint damage over time. Lubrication injections. Injections of hyaluronic acid might relieve pain by providing some cushioning in your knee, though some research suggests that these injections offer no more relief than a placebo. Hyaluronic acid is similar to a component normally found in your joint fluid. Realigning bones. If osteoarthritis has damaged one side of your knee more than the other, an osteotomy might be helpful. In a knee osteotomy, a surgeon cuts across the bone either above or below the knee, and then removes or adds a wedge of bone. This shifts your body weight away from the worn-out part of your knee. Joint replacement. In joint replacement surgery, your surgeon removes your damaged joint surfaces and replaces them with plastic and metal parts. Surgical risks include infections and blood clots. Artificial joints can wear out or come loose and might eventually need to be replaced. Knee osteotomy. For some people, arthritis damages one side of the knee more than the other side. This can cause your knee to bow inward or outward. Removing or adding a wedge of bone in your shin bone or thigh bone can help straighten this bowing and shift your weight to the undamaged part of your knee joint. Artificial hip. Hip prostheses are designed to mimic the ball and socket action of your hip joint. During hip replacement surgery, your surgeon removes the diseased or damaged parts of your hip joint and inserts the artificial joint. Knee comparisons. One of the most common reasons for knee replacement surgery is severe pain from joint damage caused by wear and tear arthritis, also called osteoarthritis. An artificial knee joint has metal caps for the thigh bone and shin bone, and high-density plastic to replace damaged cartilage. Each of these artificial parts is called a prosthesis.